Health behavior change, patient experience, and member engagement are three of the toughest challenges in healthcare. My next guest leads a company that has been tackling all three challenges for over a decade. Mike Serbinis is the founder and CEO of League, and you're going to hear his take on the current state of the nation when it comes to patient and member engagement. And spoiler alert, it's not all rainbows and roses. Mike also shares a key message for all C-level executives in healthcare. You definitely don't want to miss that. Let's get to it. Mike, welcome to the program.
Great to be here.
I'm excited to have you on the program. We've met a few times in person at events. I'm excited because I am fascinated by the space that you and League are in this sort of health prevention space. So I want to really dive into that more with you. But before we do that, Mike, can you give us and give our audience a little bit about you and a little bit about League?
Yeah, sure. Thanks again for having me today. I've been building technology companies for the better part of 3 decades now. I got my start at NASA JPL building rockets and then joined the infamous Elon and his brother, who was a classmate of mine, to build one of the first search engines called Zip2, which exited to Alta Vista, and really built a number of companies in the Bay Area and Silicon Valley before moving back to Canada. And now having built a few scale companies here, including League, I've been building technology companies that are global, all about the mass consumerization of everything, making life, better for people. And 10 years ago now, I thought, what better place to focus that energy and that experience of doing that at a mass scale, reaching, billions of people worldwide, but to do it in healthcare. So that was the impetus. League was started with this idea of healthcare would go through a transformation, putting the consumer, the end patient or plan member or consumer at the center, and leveraging data to drive a completely personalized experience for each and every individual to drive better health engagement, and where engagement would lead to better outcomes and better economics. And of course, prevention is a part of that, but so is doing, basic things like not sending faxes, or basic things like making digital experiences that people would actually love to use and actually use. More like Netflix, we often say, less like your grandparents' cable TV. So we've been doing that for a decade now. We reach over 60 million people and growing, and we do so across Canada, the US, Asia Pacific, and really growing into the Middle East and Europe this year.
Yeah, I do. I have to apologize because I did use the word prevention, but you guys do much more than that. It really is around patient engagement, member engagement, and so forth. You do more than just preventing illness. You help people stay on medication regimens and all those kinds of things as well. And I will add as well that League often is in the background, right? Your customers oftentimes you're powering their applications, right? That are engaging their members and their customers.
Yeah, absolutely. It's actually a, fascinating story of how we got there, because early days, not knowing anything about healthcare other than just being a frustrated consumer, both in Canada and in California, where I've, spent, I would say, most of my professional life in those two places. My experience accessing healthcare, whether it was through the best private pay, payvider, or the best public system, single payer, generally left a lot to be desired. And so we started building this platform with the idea that, all the things that people do for their health and healthcare, we would turn those into digital building blocks that could be used, assembled like Lego, to build amazing digital experiences. And so we started with one part of the market because, as a startup, you got to start somewhere. I didn't really know anything about healthcare other than being a frustrated consumer. And that part of the market was the employer segment. And we would sell direct to employers for their employees to make for a better health and how you pay for it, or health and benefits experience, until one day we got a call and the question came, could we use your platform to build our own experiences with our brand, powered by League, but with our brand for our millions of customers? And, we almost said no because it seemed like a distraction, right? It seemed like we had a great thing going. The curve was exponential. We were over 100,000 paying customers, and this was an opportunity to do something different. And we went for it. And in the next 4 years, so 0 to 5 years, 100,000 users. Years 6, 7, 8, and 9, we went from 100 to 15 million. And then year 10, we went to 40. And in the last 6 months, we crested 60, now 63 million. So a real shift. We enable people, healthcare insurance companies, healthcare systems, really anyone in healthcare, to build better apps, portals, better digital experiences that really are a step function change in their experience for their customers.
So, Mike, given the unique position you have in the market, you engage with payers, you also have some providers, you have a wide range of customers. Where do you see the current state of engagement right now? Are we in a good spot? Are patients and members really engaging with their care, or do we still have a lot of work to do?
Yeah, look, it's a great question. It's something that I reflect on all the time. And I feel like 10 years in, and it's the longest as an entrepreneur who's built now several companies going after hard problems globally. It's the longest I've spent on any one of those problems. So 10 going on 11 years at League. And there are a lot of bright spots, whether it's some in Canada, some in the US, now overseas, where the engagement is like next level and people are being connected to the right service at the right time based on their data and their needs for their health. But they're just that, they're bright spots. If I look at the overall industry, it's slow moving, and there's a lot of good reasons for that, and there's a lot of reasons that are frustrating for that. But for the most part, it's still early days. It's still early days in this transition to engaging people and doing so not just when they need you when they're sick, but all of the time, leveraging that data to drive prevention and the right kinds of engagement. It's still early days, which, look, as we've built this, soon to be 100 million people that we touch, we're in a great position. And with the advent of AI, to take it to the next level. So we're really excited about that.
Well, before we dive into the AI that you just mentioned, I want to just go back to some of the barriers. Like, what are some of those barriers, Mike, that are standing in the way for more widespread adoption of these types of technologies to engage patients and to prevent, for more preventative care and more adherence to care kind of things?
Yeah. So I'll give you three examples, or three points quickly. One is to be able to engage the end consumer and the end patient or plan member. You need to know how to reach them. And it sounds silly, but most of healthcare is not in the business of being great consumer marketers. Like, most of our insurance customers, or who we call payers, most of them don't even have like email addresses for a lot of their, or phone number to send a text message. So getting to be consumer centric is not just about buying a bunch of technology and building a great solution. It's about changing your organization and little aspects along the way to be more consumer oriented. And that change comes slowly. It tends to come with like a new CEO, or some other kind of catalyst. A new C-suite is one of them. So that's point one, is just like knowing even where to reach out. Point two is about data. To be able to make great recommendations that people actually listen to, you need data, and you need data that you can actually access um, to infer what and predict what are the likely next things to talk about or next best actions. And I would say most organizations we deal with are in a data transformation journey. This is the nice way of putting it, where they're starting with a very rough situation of partial fits and starts of cleaning their data, maybe even putting it all in the cloud, or at least making it accessible, solving, for problems like security and privacy, or at least challenges. So getting your data house in order, most organizations have started that, but most are, I would say, not far along. And they're often thinking they need to wait for this one magical moment where their data, environment will be in this holy, magical state. Like, those states actually never come. You can't wait. You got to start. And so, and that would be sort of my third point is most organizations, are dealing with all kinds of complexity, budgets and changing governments and how that impacts changing budgets, and have been dealing with, cyber attacks and many other challenges. Starting is the hardest thing to do, and I often talk to, rooms full of hundreds or thousands of young entrepreneurs just starting out. And it's the first chapter in the League book. The most important thing you can do is start and iterate and move. And that's just not in the culture of most of these organizations. So it takes a catalyst. It takes like a moment, a push, if you will, whether that's a new budget, new administration, other changes in the market.
Those are I love those challenges that you've raised, because some are within our control, right? Like just getting started, the change in executive outlook becoming more patient centered, and some are external that force us to change, whether that's regulation or policy. So I can't disagree with any of those. Those are really good. So let's go back to something you said before about AI now. So how is that changing the game? Because I'm assuming it is changing the game in terms of engagement and personalization and being able to leverage all that data that some of these organizations are now getting their arms around.
Yeah, absolutely. Coming back to, delivering great, sustained engagement, digital engagement, taking pressure off labor or other slower channels, more costly channels. AI has been pretty central for us. I mean, we talk about making a 10x change in engagement, and then building off of that, keeping people sustained in an engagement journey with their health that's personalized. The core of that is data fueling AI. We talk about the League Personalization Foundry, or LPF. It's a set of machine learning models that can be used to predict and then direct next best actions for each individual. And the better you are at that, the more likely it is you will get people to convert on whatever you're suggesting, recommending, a next step in a journey, next step in a chronic condition management program or post-op recovery protocol. And we believe, that the consumer is in many ways at the center of transforming healthcare, but doing that, empowering that consumer at the core of it is data and predictions, i.e., using AI. And so we've been on that journey now for about 5 years. But this is a moment in time where, like, and we have been over the last 12 months, taking the next step function change, which is really exciting.
So I just want to make something clear, Mike. I mean, it sounds like what you're saying to me is that AI is using the data that from an individual patient and then making a recommendation on the next best step by mixing in what the protocol for their treatment or their illness is. and therefore coming up with something that is tuned to that individual. Is that right?
Exactly. The idea of personalization down to n equals one, down to the individual. Not all 50-year-old dudes in Toronto or in Manhattan that have a history of diabetes or hypertension, but down to the individual. And with AI, we can now leverage an enormous amount of data, both data that comes from systems we know about, like EMRs and claim systems, but also self-reported data, user-generated or wearable remote patient monitoring type data, and frankly, a lot of synthetic data that can be used to drive personalization that people will actually, convert on and follow through with.
When I first learned of League and learned what you do, I always thought you guys were almost half, if not more, in the behavior change business, right? Like, because you're trying to change the behavior of individuals. Because as an outsider looking in, we all would think, oh, shouldn't being healthy be motivation enough? But League is proof that that is not enough, right? Just that is not enough of a motivator to get people to do what they're expected to do. Is is part of what League does is kind of pull the right lever for these individuals too to get them to take that action?
Yeah, exactly. There are, many sort of studies and a huge body of research on what will get people to make changes. Um, so in many ways, there's no need to reinvent the wheel. That science and the technology that comes from it exists in the world. There's many examples you can draw from the world of gaming, many examples you can draw from other industries, which we have to get people to do that next best thing and to stick and to keep on a program or a journey. So that's something we've absolutely done. And if you think about today, well, League now has a very different scale than we did 5 years ago. And with that, different experience, with tens of millions of users and a lot more data. And last year we processed north of 100 petabytes of data, which is something like 850 years of continuous HD video equivalent. It's a lot of data. And you can imagine how we have a natural and growing advantage to get better at the predicting and getting people to engage and convert. So it's something that we do. It's a big part of what we do. Obviously, some aspects of the platform are, table stakes, replacing aging infrastructure or rationalizing like 50-point solutions that nobody uses. We have to do that. That's a part of like the process of transformation from old to new. But what really matters, you could do all of that, but if nobody used the thing, the experience, it'd be for naught. So behavior change, engagement is at the center of what we do and what we do well.
So of all of the projects, including the AI ones that you're working on at League, is there one that you're most excited about, Mike?
So if you think about what we have been building, right? A platform, lots of Lego blocks and can be fit together to create different solutions, whether that's a modern member portal or, health engagement solution to close gaps in care. Lots of examples. Um, Today, those typically involve a human at the other end, interacting with some kind of screen, right? An app, a portal, a website, and so on. Um, the thing that I'm most excited about is how that changes to be largely agentic and
Mm.
how 24/7 every League user will have not one, but many, a multi-agent system working on their behalf, leveraging data that they have permission to use to then go out and, uh, improve the individual's health and health journey. And so we have been building and now deploying into production multi-agent systems, which take certain certain experiences that may be like 20 different steps for a human being, and like condensing them down to like 5 seconds. Um, and we are starting to roll those out more broadly um, this fall. So I think this agentic revolution um, across all computing, but especially in healthcare, where like look, there's a fragmented healthcare system in terms of its experience for the end user and then the underlying infrastructure. And I don't think the fragmentation in the back end is changing anytime soon. I don't think there's going to be one magical database that gets built that has everyone's, information, and everything is just easier because of it. Um, and so the prospect of deploying autonomous agents, which are guarded and secured, and all report back to my personal health agent, which acts as an orchestrator, and a safety valve, if you will. I think it's just going to revolutionize the entire category and the entire industry. And so that is the thing that I'm most excited about. We introduced last week at League Power Up, our kind of mid-year all hands conference. We introduced Quantum Leap, which is our and I'm a physicist by training, so you got to throw in some physics references every now and then. This shift to becoming AI native, and in particular this agentic shift, and agents will interact with you wherever you are, maybe through an app, it may not be, maybe through voice to your phone, through text message, through a mailer that comes to you, maybe a human that comes to your door, what have you. The agentic revolution is by far the most exciting thing that I see happening in healthcare.
It will be pretty impressive for the day where I have my own personal health coach, my health coordinator, care navigator, if you will. It sounds like where you're taking things where it just knows how to navigate this very complex health system for me, with me, based on my needs and my behaviors versus sort of trying to fit me into that round hole with being the square block. Right?
Yeah, totally. I think this this is the beginning of a kind of new wave of experience. And I mean, I have three daughters who are now in their teens, um, but it would be great. It would be a great time to have, a 5-year-old or a 4-year-old, and see the world, this new AI world, through their eyes. The level of expectation of how things should work. Just like I remember my daughter once touching in a hotel, she was touching the television. It was one of those older TVs with a cathode ray tube. She's like, "Dad, what is this?" And I said, "It's TV." And she was like, "What?" But TVs are, on the wall. They're flat. I'm like, "No, no, this is a TV too." And she kept trying to swipe the screen to change the channel, right? That was a shift in humankind's understanding of how to interact with technology. We're about to go through another big version of that. And honestly, I think we're in a Gutenberg moment here. It's the biggest disruption, certainly in any of our lifetimes. And with that comes opportunity.
So Mike, I have to ask you this. What message would you like to give to any health system CEO, CIO, or CMIO that's listening or watching this? What message would you like them to take away from our conversation today?
So a year ago, I had health system CEOs and C-suites on my stage at Lead Connect, and I asked them about AI adoption and this next wave of experience in healthcare. And the message I got then was, we're going to be a laggard, healthcare, the proverbial we. We'll see. We'll wait. A year later, I hear about 50 pilots, going on, and that's in one organization. Um, we are in a Gutenberg moment, as I described, and any CEOs that haven't lit a fire in their organization yet to both transform internally and how they operate as a business. I just came back from let's call it a senior government meeting without getting into detail. And this transformation effort around taking cost out through automation and through AI so that you can then invest into the future and transform the experience for what's next and deliver higher efficacy, higher output, higher ROI. If you're not already doing that, you're too late. So I guess the message that I would deliver is you need a sense of urgency. The time is now. And with League, you've got not only the combination of a vertical, healthcare expert in experience, but one that also is working with the leading AI firms and has unique technology that ultimately drives that experience at least a 10x over what it was historically to drive better outcomes and better economics. You need partners. We're one of those partners, and you got to get moving.
I love it. I love it. Mike, final question for you. Where can people go to learn more about League?
Thank you. Yeah, they can come to www.league, like sports, league.com. And of course, they can come visit us at, awesome conferences like HLTH later this year. And, we're on the circuit, but check us out online at league.com, and we'd love to engage with you.
Well, Mike, certainly appreciate your time and all the information you share with me today. Thank you for being on the program.
Yeah, my pleasure. Great to be with you, and let me know if we did a good job when we can come back.
What impressed me the most was how League is using data combined with AI to build personalized engagements for patients, all with an idea of N of 1. I really loved how their work goes beyond just personalized emails and gets into behavior drivers to spur patients and members into action. Do you agree with Mike's key barriers to improve patient and member engagement? What did you think of his message to CEOs, CIOs, and CMIOs at health systems? Let me know in the comments. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.